It has been my honor and privilege to work with the various teams to write this Gillette Children's Healthcare Press series. The series started with Lily Collison writing the first book, Spastic Diplegia, Bilateral Cerebral Palsy. Lily has lived experience as the parent of her son born with cerebral palsy. I first met Lily in this capacity. Her level of knowledge about her son's condition was clear to me from the outset. She had gone to great lengths to educate herself so that she could advocate for her son and her family. She convinced me several years ago about the need for a book about CP for those with lived experience. For decades, Gillette has had a commitment to worldwide education. In partnership with Gillette Children, she shared her journey and knowledge. The publication of that book in 2020 launched Gillette Children's Healthcare Press. Gillette Children's became one of the first children's hospitals in the world with its own publishing arm. Lily's background in medical science and her passion positioned her to lead this effort. The first book received very positive reviews not only from families and individuals with the condition, but also professionals from diverse backgrounds worldwide. We received feedback that there was need for other books relevant to other conditions. We formed teams to write the healthcare series, maintaining a focus on high-quality, detailed information with an international focus geared toward people and families living with these various conditions. Families and professionals working well together is key to best management of any condition. These books underscore the importance of that family and professional partnership.
Craniosynostosis is a condition that happens in 1 in 2,500 to 3,000 births. Receiving this diagnosis for your child can feel overwhelming to a parent or caregiver. The amount of information available on the internet can only add to that overwhelming feeling by not knowing what is or isn't a credible source. The goal of the book, Craniosynostosis, is to provide a clear explanation of what the condition is, what the current medical recommendations are, and what to expect as your child grows. We've included stories from families who've taken this journey and hope they are supportive to individuals caring for someone with craniosynostosis.
Craniosynostosis is a condition where the bones of the skull fuse together too early. It is relatively uncommon, occurring in 1 in 2,500 births. In most cases, surgery in the first year of life will effectively correct it, and those affected can expect a typical life. Cranial sutures are the fibrous joints that connect the bones of the skull. The premature fusion of these sutures in newborns or infants, as occurs with craniosynostosis, can impact head shape and other aspects of health if left untreated.
My name is Heather, and I've been married to my husband Jason for almost 20 years. We live in the suburbs of St. Paul, Minnesota. We have 2 boys and a girl, each 2 years apart. Our middle child, Keegan, was born with craniosynostosis. I worked at a level 1 trauma center for the last 15 years as a physician assistant and thoroughly enjoy helping patients and their families achieve the best outcomes for their health. Once the term craniosynostosis came into our lives and our son went through his cranio journey, we developed a newfound passion to spread craniosynostosis awareness. Keegan was born on a Saturday late in the evening with temperatures outside below freezing. Our firstborn son was at home with my parents, anxiously awaiting the news of his baby brother's arrival. Labor progressed similarly to my first labor until it was time to push. We anticipated a speedy delivery, but it took more pushing than expected. Keegan's heartbeat would go down with contractions, which was a bit worrisome. They decided to use a vacuum to facilitate birth, which was used for just a minute because Keegan then decided to enter the world. When he came out, the doctor found the umbilical cord was wrapped around his neck twice. We were so relieved when we heard him cry for the first time. I recall my husband seeing him first and making a comment about having some buggy eyes. I felt slightly concerned and thought that was an odd thing to say, but by the time I was able to meet him, he could not have been more perfect. He had big, beautiful eyes that were very deep, slate-colored blue. He stole our hearts from that moment. We did notice he had a mark on the top of his head in the shape of a heart, likely caused by bruising during the delivery. At the time, we thought it was sweet. Little did we know how much it would actually come to mean to us. We first heard the term craniosynostosis when we brought Keegan in for his 2-week well child visit. It was a new term for my husband. If I had learned about craniosynostosis in physician assistant school, it was just a mention at most in the pediatric section, not even enough to trigger a memory of the term.
For this series, I worked with the authors and other editors to ensure that the books explain the complexities of the conditions and their management. The latter combines best available evidence from international research, along with clinical expertise of our providers. The books also include the lived experience. Having this grounding in the best available evidence and the family perspective on these complex conditions will ultimately help families and healthcare professionals make the most informed care choices.
Gillette Children's Healthcare Press furthers Gillette's vision to create a world in which every child is able to create their own story. These books will serve as a resource to provide information about these conditions and assist families as they look to the future. Not only will patients and families benefit, but we know based on prior publications that other healthcare providers and professionals around the world who work with individuals with complex medical conditions will use these books to further their own knowledge and better serve these patient populations. Gillette strives to build a better world, and I'm incredibly proud to see the publication of this book series do exactly that, furthering Gillette's global advocacy work.